through all stages of life, it is important to be informed about our health and our bodies. But you know, some topics have been a little taboo over the years. That leaves many women feeling kind of confused, specifically regarding the time of life when women experience menopause.
That's right, yeah. But thankfully, it seems society is much more comfortable discussing this topic, and women are starting to seek support from their friends and ask medical advice from the experts, like our next guest. Julie Spencer is a nurse practitioner certified in functional medicine. Welcome to Great Day, Washington, and thank you so much for being here.
Yeah. Thank you. I'm excited to be here.
Yeah, I mean, we're so happy because it really is a topic that more people are talking about, but there's just a lot of confusion around it. So what are those most common misconceptions, if we can put that in one sentence?
I think it's important to know that menopause, perimenopause, and menopause can start as early as the mid-30s and extend into the mid-60s. It's a long period of time. Every woman's story and journey is unique, and I think there's many different factors that can influence it. I think also knowing that there's many different symptoms. It's not just hot flashes that we hear about so often. Sleep disturbances, mood swings, anxiety, joint pain, the list goes on and on, weight gain, all of those are common symptoms of menopause. And lastly, I think there's a huge fear about hormone replacement therapy, and it's not all bad. It can be helpful for the heart, for the brain, and the gut.
Okay. I'm glad you brought up the gut. Okay, so the gut health, it sounds like it's pretty influential when it comes to your hormones and the balance that's going on. How does it play a role in this in menopause?
It plays a huge part.
Okay.
You know, when estrogen decreases in menopause, you see it can lead to a thinning of the gut lining, which can then affect making it more at risk for leaky gut or intestinal permeability, excuse me. And that can lead to inflammation in the body, and all of that then leads to decreased many different symptoms. And so you see you want to heal, you want to work on the gut and focus on the gut, and by doing that it helps with hormone regulation, which then in turn helps with mood swings and anxiety, managing anxiety and depression. It also can help with indigestion and constipation and bloating that are common symptoms of menopause. And as you continue to manage your gut, it keeps going and going. It's so effective in managing all sorts of symptoms with insulin resistance and metabolism and that nasty weight gain that we commonly will see.
Oh, geez.
So once we hear all these symptoms and we're like, okay, we're not going crazy, right? It's not just us. Like, this is supposed to happen, I guess, right? So once we discover that, what is the best way to go and seek treatment and understand if HRT is good for us, or?
I think knowing that you have options, not being afraid to focus on the different symptoms. Sleep is important, rest, getting 7 to 8 hours of rest a night, focusing on nutrition and protein, weight-bearing exercises and strength training, not being afraid of hormone therapy, knowing that there are many different options that are individualized, bioidentical hormones that can be delivered in a patch, a pill, or a cream. And there's also non-hormonal therapies and options available. Also, there are daily supplements that help. Magnesium, omega-3s, vitamin D, and B complex are my favorites.
We are complex.
The joys of being a woman, huh? But at least we're in it together.
And we're talking about it. I love you said that, because there was the stigma around it. I feel like we are luckily doing more segments. We're talking about it a little bit more. How would you push even further past that, where you can just talk about menopause to anyone?
Sure. I think knowing that in treating menopause as not a detriment, but as a launch pad, it's not a limitation. Learning and not being afraid to educate yourself and learn the different options, which leads specifically to finding that specific healthcare provider who can help you manage your symptoms and navigate this phase of life.
All right.
You need a team.
That's great advice. Thank you so much for being here, Julie.
Thank you.
Thank you.
You can get in touch with Julie by visiting her website, juliespencerwellness.com.